Well, good evening and welcome back to Wellness Convo. This is your host, and we do have our co host, Kajal Rane. Very exciting today to actually have a very energetic and highly dynamic personality amongst us today, Dr. Kusshal Hajela. And it's interesting how, these conversations actually start becoming so impromptu and yet so dynamic and so useful. So, Dr. Kusshal Hajela was somebody, that I've come across in the recent past, I should say. But needless to say, I think we started talking like we've known each other for many years. And voila, we are here today for a very nice, interesting conversation in the Mentza platform with the Smart Health series. And today's conversation, my dear Mentza listeners, is going to be smart health tech aid in the ICU and OT. So without much ado, Dr. Kusshal, good morning, good afternoon, and good evening, because we have listeners from all over the world. Welcome on board. If you can unmute yourself.
Hi Lalitha, good evening. How are you?
To you, Kusshal. It's a pleasure to have you here, and really in such short notice to actually agree to be able to do this podcast, which is actually going to be a very useful podcast. And your insights and your experiences are definitely going to be very value based for us. So, Kusshal, before I move on to our conversation, I want to give our Mentza listeners a little background about who you are and where you come from. Kusshal is actually from Bhopal, Madhya Pradesh, and he has pursued his medical degree from Mumbai, from MD from Vadodara, and he's had a scholarship from AIMS, super specialty in cardiac anesthesia, and he's also worked as a consultant in cardiac anesthesia department in various different hospitals. He's currently working as a consultant cardiac anesthesiologist in heart and lung transplant department of Sahyadri hospitals in Pune. So, Kusshal, welcome. It's lovely to have you again. And, we've been talking about so many different tech aids that can be beneficial for the health and the well-being of our listeners in Mentza today. But specifically, today's topic is geared towards technology, or the aid of technology in ICU and OT, which is really your forte and your specialty and your hub. So, Kusshal, I would love to, get your value-based insights with experiences that you have had, stories that you can tell us, and so much more that we can have Mentza listeners take home today. So, first of all, how has technology, you think, evolved in the ICU and OT in the past decade, and what are some of the most significant advancements in your opinion?
First of all, Lalitha, thank you for having me here, and thank you for that wonderful intro. And you're coming to your question, technology has tremendously evolved right in front of me over the past 10 decades. Technology in OT have gone beyond my imagination, Lalitha. Today, OT, there are hybrid theaters where we can perform the surgeries and do other interventional procedures together at the same time. And even there are robots in OTs now. I can tell you, 4 years back when I was pursuing my super specialty in SGPCI Lucknow, we started doing robotic bypass surgeries, CABGs, robotic. So it is a tremendous growth, which I can see right now. Today, we have even gigantic and accurate anesthesia machines in OTs now. And technology has evolved a lot over these years.
Well, I must say it has given you a life, so to say, because if you have to have sleepless nights in the ICU and stay alert with, clipping up your eyelids to not give it a shot at any given time and have so much alertness, I think technology has definitely kind of improved your lifestyle and certainly enabled it to be a better, which is wonderful, Kusshal. And I think that is one of the most critical things that we would like to share with our Mentza listeners through our platform, where we really, because Hikigai is also such platform which is actually providing that aid and the assist and enabling doctors or stakeholders to be able to take advantage of making their life a lot more easy, in terms of not just taking charge of everything that might go like unnoticed, or there could be errors that could happen. And that is really where I think technology is by far a great benefit. But that
True, true.
definitely brings us to some critical examples, which I think some of the examples you've already shared, some of the monitors, some of the drug monitoring, some of the inventory keeping, and just having one screen for almost 20 patients and being able to get a view, a single view, bird's eye view, and be able to kind of get an idea of all your ICU patients. But specific examples of smart health technologies, can you kind of elaborate on that? How that has been integrated in the ICU and OTs, or just in your specialty, like cardiac specialty, right? You do surgeries, you do so many different procedures. Can you be a little bit more specific on some of the things that we could probably give insight
Sure,
to our
sure,
Mentza
sure. I'll tell you
listeners?
about all the surgeries and
Sure.
everything which we do in ICU and OT. I'll tell you a
Uh-huh.
recent example. A week back, we all were reading in a newspaper that a surgeon has performed a bariatric surgery in Delhi
Okay.
using
Okay.
Apple Vision Pro, an AR device,
Wow.
on a patient of
Wow.
155 kgs. He performed
Okay.
a sleeve gastric bypass and single anastomosis duodenal ileal procedure with an unprecedented clarity.
Wow.
Such technologies give a highly immersive 3D environment to visualize complex anatomical structures, and they give enhanced precision. They enhance precisions and minimizes risk, and also improves patient outcome. Similar technology was used in Brazil also for
Mm.
shoulder arthroscopy.
Okay.
And there are certain things called Internet of Things. IoTs are very
Sure.
common these days. For some examples are smart monitors, which I have already told you. In ICU, they can monitor ECG, BP, temperature, even the breathing patterns and cardiac outputs of the patient. Assess your rhythm of heart in ICU right now, which can assess the movement of the patient. They can track that and prevent the older patients to fall from, or they can even predict the seizures. And the main important thing is the biosensors are available now. One of the most useful technology.
Mm-hmm.
Currently, we are using that in transplant patients. It
Wow.
basically allow providers across the world to monitor patients and provide proactive care. So these biosensors are worn on the body, and we can monitor vitals anywhere sitting across the world. And
Interesting, interesting. And the fact that you can even do a bariatric surgery, because that's one of the most complex surgeries that actually is done, and with
yeah,
so
that
much
patient was of
precision.
155 kgs, Lalita. That's a lot.
Wow,
A
that's
very
pretty
difficult procedure.
incredible. That's
Yeah.
that's pretty mind-boggling. That's pretty mind-boggling, Kushal. And so that really brings us to an insight of how does patient monitoring, how was that whole scene changed in terms of technology enhancing patient monitoring, especially having gone through this pandemic of COVID. And I think the whole scene has definitely kind of given a different avenue now with technology being involved. How has that improved outcomes in critical care settings? Because that's really where you need to be, like, so vigilant and so alert at all given times, whether it's the nurse or whether the attending doctor. So how is that specifically improving conditions in critical care settings, Kushal?
Absolutely, absolutely, Lalita. Smart technology and digital transformation in healthcare are changing the way patients are being treated now. They are
Mm-hmm.
paving the way into the future and flipping the whole game on its head right now. One of them is telemedicine, which we are using. It is a form of a shared platform, and
Okay.
it has significantly reduced mortality in ICU. As in, we can discuss on telemedicine about the diagnosis of a patient with our seniors, also with various other doctors, other specialty doctors, whether a patient is involved or not. And I told you about smart wearables, right? So
Right.
I'll tell you about one research project which was
Mm-hmm.
used in these smart wearables were used in world's largest heart health research project to screen
Okay.
around 10,000 patients with suspected atrial fibrillation, that is abnormal heart rhythm, with 94% accuracy right now.
Wow.
And
94.
yeah, and even cardiac output can be measured through these technologies, and which is a boom for cardiac patients, for us patients who are in cardiogenic shock. And yeah, and there is one more very interesting thing. There is connected emergency response team right now.
Okay.
Whether the patient is coming in ambulance and to the ICU, what we can do is right now we can transfer the vitals, or the live the physician in the ambulance can see it live, all the vitals of the patient and what is the condition of that patient, and directly patient can be shifted to the ICU, and quicker patient history is given, and even video calls can be done with the doctors inside the ambulance. So yeah, it has
That's
evolved a lot.
this is almost like, you're seeing a thriller movie on screen, where everything is happening as in when you speak, and considering that it is to do with somebody's health and somebody's life. If
Yeah,
this can be a big savior in terms of how it can change and enable the conditions of a person's human life,
completely,
I think
completely.
that's like
Yeah.
the biggest breakthrough there. That's pretty incredible, and that's pretty mind boggling, in fact. So yes, artificial intelligence and machine learning has certainly changed the insight, the way we look at healthcare today. But a place like India, especially, Kushal, and I'm sure you would have experienced this, hands on, and from the time that you've were a student to now you are a practicing physician or a doctor. How do you think that that role has has that been beneficial for you, so to say, or how do you see that doctors are actually viewing this? Because there is also a little bit of a, that sometimes they feel like that artificial intelligence can also be a threat in terms of some of the ways that it could be enabled or it could be considered for healthcare. So, where do you see that role of artificial intelligence and machine learning specifically in healthcare?
Yeah, I see it in a different perspective. I don't think it is a threat that way.
Uh huh.
According to me, AI stands at the forefront of the innovation right now. It has the
Fantastic.
capacity to analyze vast data sets, which expedites diagnostic procedures. I recently just I told you about telemedicine also.
Sure.
AI even is assisting healthcare providers in interpreting medical images like X-ray, MRI, and with improved accuracy and efficiencies. Similarly, it is with patho slides also. They are giving prompt diagnosis of the slides. And I'll tell you one interesting thing. As per the report from International Health,
Mm-hmm.
AI could help increase the productivity of healthcare workers by 40% on an average.
Wow.
And there was a
That,
report also, Lalitha, in Howard University, that implication of AI can help save up to $360 billion annually. Can you imagine that?
That's pretty incredible. We definitely need to capture this data, Kajal. We need to put this on records for us,
Yeah.
and we need to catch this guy and have him be our spokesperson. So, Kushal, that's certainly some very significant data that you've shared. The dollars that you're talking about, and not only that, the 40% increase in the efficiency of healthcare professionals, that is absolutely critical, especially in a place like India, where we are definitely in shortage of healthcare professionals to attend to the number of, the patient to healthcare professional, quotient. But that really kind of adds more time and effort. And we did have this discussion, when we spoke, one on one, that doctors are, after all, they're human beings, and there is a
Yes, correct.
burnout that happens, and we cannot be consider them to be the magic makers at all given time, unless there is specific aids and provisions provided to them also, even though they may be really good surgeons or really good at their profession and their skill sets. So what kind of training do you see that and support that is required for these healthcare professionals to effectively use these technologies in the ICU and OT? Because I think that's one of the big discrepancies that's actually happening as we speak. There is a big change and a shift happening in India with the digital era coming in. What kind of training and support do you think that doctors should take, Kushal?
Definitely, training is required, Lalitha. Actually, see, I'll tell you one thing. Being a medico, most of us are not at all tech savvy.
Uh-huh.
Our area of interest has always been medicine.
Sure.
So we have to get along with the IT professionals and the team involved to learn every bit of it. Actually, I'll tell you one more thing. There's a very famous dialogue of a movie, Border. If you can,
Uh-huh.
I'll
Yes.
tell you in Hindi. It says like "हम ही हम हैं तो क्या हम हैं, तुम ही तुम हो तो क्या तुम हो." It means we can only work together for a better future, and nobody can transform the game alone. So
Uh-huh.
there should be frequent CMEs, webinars for the doctors to get themselves adapt to new changing technologies. And there should be time to time query solving sessions for doctors. Even doctors can give some advice to the people involved in technology, and vice versa. Learn Doctors have very less idea about software involvement. So
Mm.
and the working of the machines, how to maintain these machines for a longer duration. So in total, together we learn and together we grow.
Well, आप तो शायरी पे उतर आए यार. This was really cool. I love the way that you brought that in terms of an analogy, and I think that's how our Menza listeners would be able to remember this phenomenal conversation that's happening. And it's so important that you just so rightly said that we need to evolve as we go with technology and the advancements that's happening. Yes, when you're in a medical field, there is so much to learn and there is so much to absorb, and as such, it's a very drilling and a grueling, profession in terms of your 8 years of your qualifications and taking all your exams and just qualifying to become an MD. I do understand that, but I think the infrastructure and the curriculum should already have technology embedded in it in many ways, and of course, taking the CME credits and everything would be added value to really be hands-on with the advancement in technology and how that can make it an enabler for a doctor today. So that's very good information and very good insight that you have shared, Kushal. And
Thank you.
so,
Thank you.
the last thing that I do want to ask you amongst all of these fancy questions that we have today for you, but I will put you on for a, offbeat question after this. But before that, finally, what is one advice that you would give, Kushal, to all our healthcare institutions in taking or looking to adopt new technologies in their ICUs and OTs? What is that one thing that you could probably share for our healthcare institutions?
I would like to say that smart technologies can play a crucial role in the future for treatment, recommendations, patient engagement, administrative activities, and resource management. It is going to change patients' life, our working style, and provide a good patient outcome. So
Mm-hmm.
these AI or IoTs are emerging technologies, and we should adapt ourselves towards this. And
Sure.
these are beneficial for both doctors as well as the patients. And companies like Hikigai are helping us in all the possible ways, even providing such technology at an affordable cost.
Mm-hmm.
So and even the data are secured. They are HIPAA compliant. All the data are secured and carried out in a legal way. So I would suggest them to adopt these new technologies and just evolve the technologies and move forward with it.
Fantastic, fantastic, Dr. Kushal. I think you've really kind of stolen a lot of wonderful captions that we could certainly, put it down in our records. And for our Menza listeners, we do have Kushal, who's going to, without announcing to you, Kushal, I'm going to take the liberty to say we need to bring you for a masterclass because you have so much to share, so much vivacious energy. And I love the way that you kind of really portray the adoption of, taking what's happening today, now, and here. I think it's very important that the learning process, even though we all get qualified to be professionals in our own field, whether it's being a doctor or being a musician or being an artist, whatever we are, I think evolution is one of the most critical things, and change is something that people are not able to readily accept. And that is something that is very critical, especially in the healthcare field, considering technology. So, my dear Mentza listeners, we have heard it firsthand from a very qualified, a very able, and a very energetic doctor in on board, who's actually, he's in the cardiac field, and he's also in the ICU and the OT, where technology can be critical at every given second. So, if he's able to give us that insight and value of how technology is an enabler today, I think we should definitely take advantage of what are some of the passions that you follow, and is passions that you follow, do you take technology as an aid or an enabler for yourself, or is it off from technology?
So currently, my passion, Lalita, is playing with my daughter. uh,
How sweet is that?
yeah,
Okay.
that is my after coming home from the hospital. I'm so tired, but still, just her smile makes my day. So currently, I'm just doing that, and apart from that, I play guitar, I play table tennis. So it's apart from the technology. I'm not that tech savvy as of now, but
Okay.
yeah, I'm looking forward to it. I've started doing some things now, so we'll see in future. I need people like you to
Well,
teach
this
me
is the
of the technologies and everything.
absolutely, absolutely. And I think there is a reason why, we bring in a lot of healthcare professionals with a purpose here, because I think besides the fact that you have a professional skill, there is also that person and the personal touch that we want to also bring in for each person who comes into our Mentza platform. And Kushal, personally, do you also take aid of any of these IoT devices like a smartwatch or
Yeah,
any
yeah,
of
sure. I'm
these?
using a smartwatch. I daily I'm looking how many steps I am taking right now. What is my heart rate? I'll share one anecdote with you also.
Sure, sure.
Once we were in the theater and the patient was very sick, just about to as in succumb in the theater itself.
Okay, okay.
That time my junior came to me and he showed me my watch and the stress level was 100% red
Oh my
at that
God.
point of time. So I first cooled down myself and then concentrated on the patient's health. And luckily, the patient survived and everything was great.
Isn't that something, Kushal? We kind of don't take ourselves, we don't pay attention to ourselves, and we take ourselves for granted, not realizing the stress that we are going through during our
Correct. Yeah.
during our actual action in the war zone, so to say. But it is so important that doctors themselves are also able to keep check on their stress levels, their mental agility, their emotional agility, and that really what makes you good at your work. So it is something very critical that you have shared, Kushal. I hope Mentza
Mhm.
listeners are actually able to take this with a grain of salt and realize that doctors themselves can also be considered in terms of having high stress levels, and
Yes.
considered to be going through a lot emotionally and mentally, which is with a smart device like a Apple Watch can totally help them out. And I'm so glad you mentioned this. For me, I
Mhm.
think the biggest aid that I see from my smartwatch is how quickly I can move around when I'm doing a sitting job, especially now with the kind of job that I do. I think the biggest aid that it gives me is time to stand up, is every so often when it says that to me. That's
Correct.
really the simplest thing that I think it has enabled me. But I would love for Kajal to actually contribute a little bit, because Kajal is, she is my backbone for this entire platform, and Kajal is always a silent listener, but being
Mhm.
my co-host. Kajal, is there anything you would like to share in terms of what Kushal has shared today, and what he has contributed? Because we've had a very different agenda. In terms of how we can, tell our Mentza listeners. So, if is there anything else that you would like to share? And I know you may not be able to talk, but if you want to put it in your notes here, I can read it on behalf of you, because she's actually recording our conversation, and we
Okay.
would
Okay.
like to have this on records for us. So, for all Mentza listeners, Kajal, if you can also share Kushal's LinkedIn profile, or do you have a personal page that you would like us to share, Kushal?
I uh, I don't have a personal page right now, but you can share
Okay.
my LinkedIn profile with you.
If that is okay with you, yes, we
Yeah,
would love
yeah,
to share
absolutely
that,
fine.
because I think you are a big inspiration, after all, Kushal, for all those people who are in the medical profession, for all those young people who are wanting to be in the medical profession. The one thing that I think we can take from Kushal's insights today is that hands on with technology is very critical, and the whole face of healthcare is definitely going to be different. So please be ready for the change and be ready to accept
Sure,
the change as you evolve with it. And needless to say that the privacy of the data, or when you're protecting the data, the falters that can happen, many of this can be enabled through technology. Once again, Kushal, it was such a pleasure to have you here. And like I told you,
thank
I've
you,
already
thank you.
taken the advantage of telling that we want to bring you back for a 1 hour session,
Sure, sure,
for
sure.
a
Definitely, we will
uh,
work towards it.
yes, yes. And I definitely want to have a more deep conversation. Maybe we could have a few other people who can also come from the medical profession and have like a chit chat with chai or something, where we could speak
Sure,
over
sure.
a nice hot cup of
Definitely,
tea.
that sounds
But
a good idea.
yeah, yeah. Thank you so much. And Menza listeners, this is our wellness conversation. We have had about 37, am I precise, Kajal? This is our 37th series. And thank you so much to Kushal, who has actually shared some great information, some great insights, who is a specialty doctor in Sahyadri Hospitals of Pune, a cardiac anesthesiologist. And any closing remarks from Kushal, if you may, please.
Thank you so much, Lalita. Thank you for having me here. It was a pleasure talking with you over such a great platform. And yeah, it's amazing. Looking forward to work with you again.
Fantastic. Well, to all our listeners, please stay tuned. This is every Friday. That's where we are. It's only about 20 minutes valued time from you that we ask for. So please stay tuned to Wellness Conversation with yours truly, Lalita and Kajal Rane, my co host. And it was wonderful to have Smart Health series hosted through Mentza platform, and I'm very thankful to Mentza platform this for this amazing platform that they have provided for us. Stay tuned, stay healthy, and stay safe. Thank you very much,
Thank you.
Kushal. Have a
Thank you
good
so much.
weekend.
You
Bye
too. Thank
bye.
you. Bye bye. Thank you.